So our very first speaker up in this session is someone who's joining us from Kids Solution. She is an exhibitor at the exhibitor fair in the cafeteria. She is a clinical psychologist. It's Dr. Amanda Azarbehi. And I got her name right. Thank you.
So I'm just going to take a few minutes to talk about a couple of touch points, and then really just to introduce the broader topic that I will be covering during the breakout this afternoon. So a little bit about me. I'm a developmental pediatric clinical psychologist, so I work with children and adolescents as a psychologist, and I take a developmental perspective. So I like to look at how are children developing? Not just where are they right now, but how are they developing over time? I work as a psychology professor at Tyndale University, and most of my research there is related to autism. So we do research looking at the effectiveness of various autism intervention programs. We do research looking at the effectiveness of peer training. We do research looking at parenting health and stress, and I'm sure nobody here can say that they haven't experienced parenting stress, right? I'm sure you all do. So we do some research looking at that, and also at dyadic coping with autism and parenting stress, which is looking really at marriage functioning, which I think is quite interesting. And so that's the one hat that I wear, my professor hat, and the other hat that I wear is my director of clinical services hat, and that's when I do my clinical work at Kids Solutions. So Kids Solutions is a child and youth multidisciplinary mental health center. We have offices in Newmarket and Toronto, and we serve all over Southern Ontario. So we do assessment, diagnosis, not just of autism, but developmental disabilities, learning disabilities, that type of thing. We do IBI and ABA programs at home and center. We do social skills groups, anxiety groups, all sorts of different things. So the question is, that I get asked sometimes, is why are intensive interventions needed? So when I was doing my graduate studies in the Maritimes, what was a very common prescription that parents were given once their kid was diagnosed with autism was to enroll them full-time in daycare, they'll be around other kids, and they'll learn social skills. And that was the prescription. And unfortunately, we did research looking at that model, and of course part of the diagnosis of autism is that they are not learning typically from other kids in typical environments because they have autism. So just putting them in a typical classroom and expecting that to be an effective intervention is not very effective. So what interventions are needed and why do we need them is a question that I have quite a lot of interest in. And I think the families that I work with that have children with autism, you need a team of people involved, right? I always ask, do you have a naturopath on board, right? Have you had your child checked for allergies? Do you know if casein or gluten is having an effect? Are they taking the proper supplements? Have they had a health workup? Do they have a speech pathologist to work with them on language development? Do they have an occupational therapist that's working with them on fine motor integration, right? Have they had their eyesight checked? Do they need vision therapy? You need all of the pieces. And one piece is early intervention services. One type of early intervention is the IBI or the ABA. So I have my not so fancy graph up here because what I want to point out is that the typical progression of development is that black line in the middle, right? So kids are born and typical kids progress at a fairly steady rate. They start learning things and they keep learning things. So they start saying one word and then two words, and first they pull up their pants and then they can do up the button, and they learn and they grow and they develop. Kids with autism, their trajectory of development is often along the red line. It is delayed, they're learning at a slower rate, and they're progressing at a slower rate. Once you have your treatment team in place, your goal, of course, is to boost the development as much as possible. But your goal isn't just to get them learning as quickly as typical kids. They actually need to start learning and developing faster than typical kids if they're ever going to start to catch up and make up any of those deficits. That's represented by the green line, right? So if your kid's following a red line of autism development and you put in a treatment team, what you're hoping is that your kid is going to jump onto that green line. Look how much steeper that trajectory is, right? They have to start learning at almost twice the rate of even a typical kid to start to catch up. And And in order for them to start learning at that increased rate, they have to have balanced health, right? They have to have the gut sorted out. They have to be able to write supplements. They have to be ready. Their brain has to be able to start making those connections. And quite often, an important piece is that they need intensive behavioral interventions to intensively teach them the skills that they've fallen behind on. Because they can't just start learning at a normal speed, they often need to learn at an intensive speed. So that is part of how I explain why often intensive behavioral interventions can be helpful, because if you partner them with the biomedical interventions, then you can start boosting up the rate. So I was fascinated listening to Dr. Mumford speak this morning, and I've read some of your work in the past. And more of my area is from a neurological development standpoint. So I'll very briefly, I don't have any pictures of prostitutes or movie stars, so I apologize for that. But I will talk about Einstein, so maybe that'll make people interested. So from a neurological perspective, what is happening inside the brains of individuals with autism? Well, first of all, I just want to take a step back and say what's happening in most of our brains. So most of you are born with, does anyone know how many brain cells you're born with? About 100 billion brain cells. Now, by the time you're 5, do you think you have more brain cells or less brain cells? Who thinks you have more brain cells by the time you're 5? Who thinks less? Right, I think you might have sensed the trick question. So yes, you actually have less brain cells, because what happens at quite an accelerated rate in the first 5 years of life is that our brain, which starts off with all of these brain cells that aren't very well connected, undergoes this process of myelinization. So our brain starts to, as we develop, in a way take notice of what are the important connections. How is it important that your brain learn to share information? And it starts to reabsorb some of the brain cells that aren't used, and it starts to myelinate or make super connections between the brain cells that are used. It's kind of like the difference between broadband and dial-up. So all of your brain cells, most of them, when you're born, have more of a dial-up connection. They can talk to each other in some ways, but they're not communicating very effectively. The pathways that you start to use a lot myelinate and turn into broadband connections. They can share information like a superhero. Super speed. So here's the Einstein equation. So Einstein, they have his brain in a jar in Stanford, I believe. They literally have his brain in a jar. And they've studied it to figure out what made this guy so smart. And a lot of people thought maybe he has more brain cells than the average person. Maybe he has like 5 times more neurons than most of us. But what they found is that that's not actually true. Einstein just has an average amount of neurons. But what he does have is 5 times more myelinated connections between his brain cells. So it's not the fact that he has more brain cells, it's the fact that his brain cells communicate. We're communicating at such a high level of efficiency. And it's that neural complexity that made Einstein a genius, and it's that neural complexity that we're developing, especially in our first 5 years of life, that makes us as humans be able to deal with such complex situations. So very briefly now, there is some research then looking at, from a neurological standpoint, what might be happening inside the brain of someone with autism. And one thing that they found is that these myelinated connections are not happening as efficiently, and they're not happening as great a number. So a really easy example, anyone here used to watch House on TV? You know, they love their MRI machine, right? They're always putting people in MRI machines and scanning their brains to see what was happening. So if you put someone in an MRI machine and you play them a certain song of music, or you show them a certain image, you can track using an fMRI how their brain is reacting to whatever it is you're showing them. So if I put a typical person in an MRI machine and I show them a picture of a dog, immediately the occipital lobe will light up because they will be seeing and processing the visual information about the dog. But almost instantaneously, the frontal lobes will light up because they'll be thinking the word, language, dog. The temporal lobes will light up because they might be remembering dogs of the past. The hypothalamus, the emotion centers might light up because they might feel warm and fuzzy if they like dogs, or they might be scared if they hate dogs. So even though the information's entering the eyes and going to the eye processing occipital lobe, it's shared along these myelinated super pathways with everyone else. Some research looking at people with autism finds that when you put them in an MRI machine and you show them a picture of a dog, the information is not shared with as many areas of the brain as quickly or in as much oomph behind it. So if we think about from a symptom perspective, how people with autism sometimes have difficulty in social situations, we might be able to put the two together and have some understanding. Because social situations especially involve, I have to look and interpret your nonverbal. I have to share that with and incorporate it with what you're saying verbally to me. I have to remember your name and details about you. I have to have appropriate emotional reaction to you. I have to be thinking about what language I should use in relation to you. Conversations light up the brain in an MRI machine like almost nothing else. So if you want to make all the parts of your brain work at once, a great way is to have kind of an interpersonal conversation. So if you have autism and the sharing of information between areas of your brain is more challenging, then you can see why especially maybe a social situation might be more difficult. So, some interesting new research then is looking at how does early behavioral intervention impact the formation of these connections in the brain. And the idea is that by providing intensive behavioral interventions at a young age, we're helping to stimulate the development of some of these connections. Typical kids develop these connections naturally through social interactions, through imitation, through just the natural world, right? Most of us, if we think how much our 5-year-old knows, we didn't purposefully teach them most of what they know. They just learned it somehow. Kids with autism, for some reason, their brain's not naturally making those connections. And so I think that one way that intensive behavioral interventions help is by helping to provide more of the oomph behind getting some of those connections to happen. So in my breakout discussion today, we're going to be talking a little bit, a lot of it will be question and answer based on what you're interested in, but I want to talk a little bit about if you are going to make a behavioral intervention part of your intervention team for your child, how do you choose the one that's right for you, right? How do you ask what is evidence-based? So sometimes emerging areas don't have as much evidence behind them, but we can talk about how they still will have at least emerging literature and will come from reputable sources. And we'll talk about what are some of the options, what do some of these different, oops. Lost mine. Okay. We'll talk about what are some of the different interventions, what do they look like, what are some of the differences, and how might you pick a match. And then the one other thing that I will say that we can discuss, because I was informed that it might be a topic of interest for all of you, is the new DSM-5 autism diagnostic criteria. So I have been to several conferences and meetings where that's been discussed in detail, and I've sat in on some of the committee meetings. So I'd be happy to go over that a little bit as well. If that's something else that people are interested in discussing, I can provide you an overview about what those new diagnostic criteria look like. So those will be the two topics. Early interventions, what are out there, and how can you tell what's a good match for you, and then DSM-5 diagnoses. So thank you very much for your time.